Collagen is the most abundant structural protein in the human body, providing strength, elasticity, and integrity to connective tissues such as skin, tendons, cartilage, ligaments, bones, and blood vessel walls. It is primarily produced by fibroblasts and composed of amino acids like glycine, proline, and hydroxyproline, arranged in triple-helix structures. These structures form strong fibrils, essential for maintaining tissue health. Vitamin C plays a crucial role as a cofactor in collagen synthesis, enabling the formation of stable crosslinks. Without adequate vitamin C, collagen production is impaired, regardless of amino acid availability. After the age of 25, collagen production begins to decline gradually, at a rate of about 1% per year. This decline is accelerated by factors such as ultraviolet radiation, smoking, high sugar intake, chronic stress, and poor sleep. As collagen levels decrease, skin starts to sag, wrinkles deepen, joint stiffness increases, and tendon resilience diminishes. While excessive collagen accumulation is rare, it can occur in specific fibrotic diseases like systemic sclerosis. These physiological changes have led to increased interest in collagen supplements, marketed as solutions for anti-aging and joint support. Collagen supplements, particularly in the form of hydrolyzed collagen or collagen peptides, have gained popularity. These supplements consist of small fragments of collagen chains that are easier to digest and absorb. After ingestion, peptides enter the bloodstream, and some studies suggest they may stimulate fibroblasts to increase collagen production. However, the extent to which these peptides target specific tissues like skin or joints remains unclear. Much of the ingested collagen is broken down into general amino acids and used throughout the body. Despite this, the market for collagen supplements continues to grow. Several small clinical trials have reported modest improvements in skin hydration, elasticity, and wrinkle depth after 8 to 12 weeks of daily collagen peptide intake, typically ranging from 2.5 to 10 grams. Similarly, in cases of mild to moderate osteoarthritis, some studies suggest that collagen supplementation may reduce joint pain. However, these trials are often limited in size, duration, and quality, making it difficult to draw definitive conclusions. Large-scale, long-term randomized trials are lacking, leaving the scientific community with emerging but limited evidence on the efficacy of collagen supplements. Collagen supplements come in various forms, including gelatin, which is partially hydrolyzed and has lower bioavailability, and topical collagen found in skincare products. However, topical collagen molecules are too large to penetrate the skin barrier and reach deeper dermal layers. Any beneficial effects are likely due to moisturizing agents, not the collagen itself. Liquid collagen supplements have gained popularity, though they offer no proven advantage over powders or capsules. Marine collagen, derived from fish skin and scales, may have slightly better absorption, but this has not translated into clear clinical superiority. Adults over 40, particularly postmenopausal women or those with chronic sun exposure, may experience some skin or joint-related improvements from collagen supplements. Athletes with high physical demands on tendons and joints might also benefit. However, young, healthy individuals who meet their protein needs through diet generally do not require collagen supplements, as protein-rich foods provide all necessary amino acids for collagen synthesis. Collagen supplementation is not effective in isolation. Collagen production requires not only amino acids, but also vitamin C and supportive lifestyle factors. Smoking cessation, UV protection, adequate sleep, and antioxidant-rich nutrition are all critical. Without addressing these factors, powdered collagen is unlikely to yield visible results. Ensuring a holistic approach is essential for maximizing any potential benefits from collagen supplements. In summary, collagen supplements may have supportive roles in skin and joint health for specific populations, but they are not miracle agents. Claims of reversing aging or regenerating tissues should be viewed with skepticism. While evidence is emerging, it remains limited. Choosing reputable products with verified peptide content and ensuring sufficient cofactor intake, especially vitamin C, is key for any potential benefit. Ultimately, a balanced lifestyle, including a nutritious diet and healthy habits, remains the cornerstone of maintaining collagen levels and overall well-being.